Hey, it's Mike with Aegis Defense Solutions. Welcome back to the Modern Sportsman, to part 2 of our medical series. Tonight, we are going to be covering chest seals and chest needle decompressions. But before we go any further, I really want to cover that we here at Aegis Defense Solutions are not medical experts. We are not here to tell you or actually say that we are training you on how to use these tools, and this video is for educational / entertainment purposes only. So if you need medical advice, we still strongly recommend you go seek and talk to your doctor about what's right for you, and to go seek actual training from groups like stopthebleed.org or the American Red Cross. All right, welcome back to the range, and we're going to cover first tonight our chest seals, when we're actually going to use them and how to use them. And to help us walk through that, we brought back Hunter, our resident combat medic, with us, a recent separatee from the United States Army. He's done his time, and now he's here to live the civilian life, but still dressed dapperly, I might add, and to go over this with us. So Hunter, go ahead and tell us, and let's start us off. When are we going to want to start using a chest seal? What is this going to be for?
So chest seals are going to be for if there's any holes in your chest cavity. So obviously your chest cavity is going to be roughly at the bottom of your rib line up to your clavicles. We can even count the trap area as your chest cavity as well, and then that's gonna it's gonna stretch out to the sides here as well, and then the whole back down to same thing, roughly right here where the ribs end in the front of the body. So about right here. Hard to describe, but
yeah, no, that's fair enough.
Where it is.
But the back is crucial too, because with bullet injuries, I mean, we could have exit wounds, and that's something that we have to contend with, right?
Yep, absolutely. So same thing with sides. You're going to lift up the arm. You're going to check for holes. Very important to catch them early on before they start sucking air into the pleural space around the lungs, and we're going to go over that.
Hence why they're usually called also sucking chest wounds.
Yes.
On 4. 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4.
Get the hell down there.
Damn it. Oh.
Now, to actually go through these steps on how to use a chest seal through a very fair, unbiased, and impartial method, mainly rock, paper, scissors, we have a volunteer tonight. Lay down, volunteer. Lay down. Fantastic. Now, he is going to strip down his shirt here in a moment, and we will actually show how to apply this and how to actually check for the sucking chest wounds and what we need to look for those injuries from a gunshot. Get cold and somewhat naked.
We're gonna have to
We'll have some Marvin Gaye right there.
pull it up, mate. Sure you...
Ow.
All right, Hunter here again. So I am your average combat medic that your mother said you have at home. Let's begin.
All right, so here we have our body. Are you injured?
You injured, sir?
He's
All
like
over the place. All over the place.
Where?
No, not with the face.
So now we're going to assume for a moment that our good friend here and volunteer has a sucking chest wound. So how would we begin to search the body for that and look for those injuries?
All right, so some rounds just rang out. We think he's hit. He went down. He felt something. So we need to get him trauma naked. So just visually looking over the clothes, that's not going to be good enough. We need to get his shirt off. We need to get him trauma naked. That means no clothes. So let's do that.
Nipples. Nipple. Pull it up. Get him trauma naked.
All the way on?
Yeah, all the way.
You're going to lose some chest hairs tonight.
All right, so we got the patient trauma naked. So now we can visually look and see, all right, do you have any injuries? Do you have any sucking chest wounds? That would be a hole in the chest cavity that would be sucking in with every breath, sucking in air around the lungs instead of air going in the lungs. And the reason why that's a problem is because as the air starts to fill up the pleural space around the lungs, then the lungs cannot fill to full expansion. So what we would do is look, okay, do I see any sucking chest wounds? I'm gonna check the side. I'm gonna check the other side. Now I'm gonna roll them over. Back up a little bit, Mike, thank you. And then I'm gonna roll you over here and then check, looking for any sucking chest wounds. All right, so
Now, if we had a sucking chest wound too, and there's fluid coming out, we would actually hear it, possibly, and see actual fluid bubbling.
that is possible.
Possibility.
That is absolutely a possibility.
Okay.
Yes.
All right, so here we actually have quite a few different models of chest seals. Some of the hyphen vents. We have the Halo series, H&H, and actually several different models of the hyphen. But Hunter, what are some of the big differences that we're looking for with these chest seals?
Yes, that's a great question. So, chest seals come in a lot of different varieties, different packaging, and that means something, right? So, the white ones here, this is the hyphen vent. The white one is 3.5 inch by 3.5 inch square, and then this one's just the bigger model of that with the vent. You can see vent right on it. Here's an old one. This is a unvented chest seal. This has been in my pocket for a very long time. Obviously, it's retired now. We're going to play around with this later today. This one here is very old. You can see it's discolored, the yellowing. That's what you don't want. This is one that maybe for training, right? But you wouldn't want to use it for real world application.
Yeah, expiration dates matter with all this stuff. You want to keep your medical equipment up to date.
Absolutely. So chest seals, that's one thing I would say. Absolutely make sure that they're not expired, because it's like a big sticker. It needs to stick on the chest over blood, sweat, or hair too. And then one thing I want to note is the Halo here. This packaging has 2 chest seals laid out flat. While the hyphens, their packaging's a little different. So it's the chest seal, it's folded like a hot dog. So there's 1 chest seal in here and 1 in here. So you always have a twin pack because you have an entrance wound and exit wound. So you're gonna need 2 chest seals. If you need 1 chest seal, you're gonna need 2.
I was going to say that, when it comes to those sucking chest wounds from a gunshot, I mean, chances are, 9 times out of 10, you're probably going to have that exit wound.
Yes. Yep. I would agree with that. And then one more tip that you guys can do for your IFACs or at home or wherever you're putting your chest seals. If you feel confident having a needle chest decompression needle taped to your chest seal, it's right there with you. So that's something that I would do if you're into buying them.
Yeah, good staging advice. Absolutely.
Yeah.
Where do you want your wound? Let's drop this from this height, and then wherever it lands, that's where the wound will be. So we'll go boop. There's your wound.
Nice.
Yeah, I won't make it too
All right,
big.
let's
We
roll
won't
you
make it a
over,
mess.
And then
We'll do an exit wound.
We'll
We'll go there. Ooh, angle. It's an angled shot.
The chest seal's gonna go right here, so it's gonna get all that hair.
Yeah.
Nice.
And we'll
Yeah.
see if it rips the. All right, so the patient is trauma naked now. So the shirt is off, chest is exposed. So I cut it off or whatever, right? So I'm looking for sucking chest wounds. I see something right here. We have a black Sharpie mark indicating where it would be. So maybe there's some fluid coming out, probably blood, right? So blood is bubbling out. Visualize that. So I see the wound, all right? So I'm gonna take my chest seal. Let's do this really old one and see if it works. So this is the H&H, and they come with a nice, oh, look at that. So I'm gonna take this, this pad here, this gauze, and I'm gonna wipe away the surface, the sweat, the blood that's coming off right here. Then I take the chest seal, it's discolored, and I center the chest seal right over the hole.
Yeah, he's got it on the nipple and everything.
All right, so quick note. As you find chest wounds, as you find sucking chest wounds, you seal them, and then you move on to looking for more. So I got that one sealed, obviously. Now I'm gonna keep looking. Check this side. All right, now I'm gonna roll you over. Oh, I see one more right there. All right, so you seal them as you find them. So here I am, just as a one-man medic here. So this is the hyphen non-vented, just like the other one was non-vented. All right, they come with a smaller Bit of gauze. Wipe away the sweat and blood. All right, center it just like that. All right, checking the rest of the body for any more chest holes. All right, I think we're good. I think we're good casually. All right, now this right side, casualty's left side, excuse me, is affected. So we want to roll them on the affected side. Oh, look at that.
Well, I know the adhesive doesn't work on that one.
The adhesive does not work. So this is why you need to make sure that your chest seals are not expired or discolored. So, all right, we'll pretend that that's staying on there. Anyways, so if we found another hole in the chest cavity, and let's say we didn't have another occlusive dressing, we didn't have another chest seal, we can use this. So just hypothetically, real quick, or let's say this one failed, all right, junk. So we're gonna seal it with this, plastic. And I have the tape right here. Battle Buddy, can you hold this for me?
Absolutely.
Excellent.
Duct tape.
This is gonna remove hair.
You're a trauma casualty. You're unconscious. Now, there was a change to the method, right? On as whether it's going to one side open when we have an exit wound, right? Are we sealing all four sides, or are we leaving one side with an open vent?
You know, as far as my knowledge goes, I think it goes back and forth on what's the best method. And right now, what I would do if this is real world, I would seal all sides and burp it later on when I feel necessary.
Okay.
All right, so chest seal, improvised, this would be called an improvised chest seal, is down. And you could do this with anything that's occlusive, any like plastic bag or something like that. So, all right, look at this. This is the chest seal that's discolored. This is expired in like 2012.
Yeah, it's just tacky now. Yeah, there's no actual
There's
adhesive
nothing.
really less. It's a little tacky, but it's not, I mean, nothing.
Yeah, there's nothing there. I would not trust this, but good for training.
2, 1.
Okay, so something we found during this training situation. So this duct tape is not very adhesive. I mean, look at this. It's just kind of coming up. So what we learned is this is standard. This is duct tape brand duct tape that I'm testing. It's really not good enough. It's better than nothing, obviously, but it's not that good. So we will look into better duct tape. All right, so we have casualty rolled on his affected side, obviously. We don't want to affect the other lung because blood on the inside of the body could just pool to the other side, and then now you have both lungs affected. All right, so anyways, the casualty is experiencing difficulty breathing, so we want to do a needle decompression of the chest. So we're going to be very careful here. Basically, this is a 3 1/4 inch needle that goes into the chest cavity in a certain area. I'm going to show you that. And this is to release any built up air around the lungs or fluid as well, because you just had a bullet go through, so you're going to be internally bleeding a little bit. And then what air did get sucked in through the sucking chest wound before I was able to seal it, that air also needs to come out so the lungs can fill up. All right, so let's do it.
No, we're not actually going to jab a needle into his chest cavity. We're just training.
Mm-hmm. Absolutely.
Unless you really want it. No, he doesn't. Okay.
Do you want it casually? No. Okay. All right. So actually, it's kind of difficult to find your spot here. So let's lay on the back here. No. As he's on his side, it's difficult to feel out the ribs. All right. So clavicle. We're going to count that as rib number 1 because the first rib's right under it. Then we're going to find this is the first intercostal space. We're going to go over the second rib. And this is the, right here. It's hard to feel sometimes without a lot of experience. So try it on yourself right now while you're watching the video. And it's going to be right here. So this is the second intercostal space, we call it, right above the third rib. So if I was doing it for real, I'm going to keep the needle inside the housing. If I was doing it for real, I would stick it mid-clavicular line, which is the mid of the clavicle bone, or the nipple line. We don't see the nipple, so we're just going to go off of the mid-clavicular line. So it would go right here. So as I would clean the site with a alcohol prep pad, and then I would go in, I would ride the top of the third rib. So basically you put the needle in perpendicular to the skin, and you would hit the third rib. Then I know I need to pivot this way and go down into the second intercostal space. And we would go perpendicular to the flesh again before we actually insert. Insert all the way to the catheter. We'll show that later, right, Mike?
Yeah.
And then I would pull the needle out, leaving the catheter, and that's when blood or air would come out. You'd hear a little hiss, you'd see some bubbles of blood or fluid, whatever it is, come out. And then I would take the tape and I would secure the catheter. So as you break the seal, it's going to come sealed, by the way, with the, just like anything you'd buy at the store. You'd crack it, open it up, that's the cap. Here is the needle, pull that out. Whenever you pull out a needle, you always say sharps, so everyone in the vicinity knows that you have a sharps. All right, so this is the needle, and this is the catheter starting at the orange part. So as you remember, this is going to go into the casualty. This is 3 inches and 1/4. Here's the catheter. The catheter slides right off the needle. I'll pull that out. Just a quick tip: when you're putting your needle away, you're going to put the holder for the needle down on the table, and then you're going to put the needle inside of it, keeping your hand away so you don't get an accidental stick. And then here's the catheter. So the orange part is the top sticking out. And earlier in the video, I showed this as the catheter tip sticking out, and then I taped it up. So imagine this is what was sticking out. Like that. And then, yeah, so this catheter would be sticking into the patient. And it has some flexibility to it. You see that? So it's not going to be doing damage while it's in there. All right, so leaving off where we were. So here is the, let's just pretend that this is the catheter part sticking out. So this is the top end of the part that's in the chest cavity. So I would just tape it on with a method such as this.
So yeah, just splitting the tape. So basically, you're going to cradle that, and then it's still attached to the chest with the rest of the tape, and keeping it in place.
And I would probably put another strip of tape. You know, you can never have too much tape, right?
The hairier, the more tape.
Absolutely. So there we are, and we're going to move the casualty. Very important. Move the casualty back on his affected side, and
To
continue
recovery position.
For this casualty. Yep. And we would continue to monitor him. If we have to stick another needle, we would do that right next to it. And we would continue to do that.
1, 2, 3.
Rip it off.
America!
Oh.
God, Kelly Clarkson!
I don't know, did that even...
The other one's, look at us, stand up. Just stand up.
Hairs.
Stand up. Have we got hairs? That one's working, man.
So that's the one that was in my pocket from
Yeah, that
years,
was.
and it still works. Oh, I'm happy about this. This is the hyphen.
Do you want him? Do you want Hunter to rip it off?
Yeah, you ready? Here,
3, 2, 1,
I'm gonna use
America!
a nice pull tab.
Oh, that.
Dude, that is, that
Show
was
him.
like a whack
Show him.
right
Look what was
there.
on your. Look at it.
Sorry, brother.
You're so brave. You're so brave.
This is the hyphen chest seal. non-vented, look at how well that sticks to your patient.
All right, so that's the wrap up of the training for looking at chest needle decompressions and hyphen chest seals for those sucking chest wounds. And just to reiterate, we are not medical experts here. This is not medical advice. And if you want medical training like that, go check out things like stopthebleed.org, the Red Cross, go get proper EMT training, and consult your doctor for what's medically necessary for you in situations like this, definitely. But with that, how did it go? Let's talk to our wonderful victim first, our gunshot wound. How'd that go for you?
It sucked. I hated it, actually.
I counted at least like 50 hairs ripped out.
It was pretty uncomfortable. I mean, luckily, you're not going to be using any of these. I mean, hopefully, you're not going to have to use any of these unless it is a life or death situation. So, I mean, really kind of in that situation, discomfort comes second to, pretty much everything else.
I think you did pretty good. We kept your nipple intact.
And
that's a win.
Ripping the back one off hurt definitely more than the front one, but the tape, I think definitely you are gonna have to look at getting better tape.
And there are options for that. Yeah.
The duct tape doesn't seem like it holds up very well. Something I will recommend too: go through your medical kit at a regular basis, cycle out the stuff that's not going to be good to use anymore.
Well, that was part of the point too, is why the expired stuff. Just like Hunter mentioned, really, really good for training purposes. So make sure those items are not expired. But for training purposes and for working with groups like this, what we're showing you tonight, they work pretty well.
And the one that did work, the hyphen that was very sticky, that ripped out all your hair, Jaden. Sorry about that, but I can't read it. Sorry, guys. It's been in my pocket for years. It might be manufactured in 2010. I think this was expired though. But the hyphen brand chest seals, they do so good. That's definitely a recommended brand.
Yeah, the hyphens I think are pretty good quality compared to some of the other stuff that we were looking at.
I would agree with that. And the halos are good too. We didn't do a halo today, but halos and hyphens, I would say, are the two best.
Yeah, and your halo wasn't expired. So yeah, we didn't want to rip that open and basically invalidate it when it's still good for a medical kit. So I think that's all for us tonight at Aegis Defense Solutions. Thanks for sticking around. And remember to go seek training. Go make yourself just a little bit better when it comes to this medical stuff. It's definitely advisable. I will say this for advice is to go seek training in these fields to help better yourself with your own IFACs and your own medical equipment that you have just around the house or for, if you're at the range. So this is Mike and the rest of the guys with Aegis Defense. God bless and good night. Be prepared, not scared.